What are you excited about when you come to CHoR?
I'm excited to play with you.
Okay,
The
play
game.
play the game. All right. Josiah has a lifelong condition where the spinal cord did not develop completely normally, and it impacts the bladder. So we have to go in and in essence, build a bladder at a valve that allows the urine to be collected in a low pressure system. Absent that, the kidneys would not be able to drain properly, and a lot of kids in the past would have issues with kidney failure, infection, and that type of thing. And so they have full control, and Josiah takes a little catheter and puts it in the little stoma that we created and drains the urine out 3 to 4 times a day. And so he's able to run around and play and be completely dry of urine, which was the first time in his life that occurred after the procedure. So it really changes the lives of the kids that have this medical condition to go through it. But it does take a lot. You know, Josiah was in the hospital for a fair amount of time, and so it's for kids this age, it can be a struggle because they want it quick fix and in and out, and that's just not how it is in all cases. So, but in the end, he looks great. He's doing tremendously well. He's taking ownership of his own body, and he's catheterizing himself at a very, very young age. So we're proud of Josiah.
Whoa!
These kids go through a big operation that can take 10 to 12 hours, and the body heals in different ways. And he was here for a minute, and so wasn't able to leave his room. And we had this great facility here, and I guess he has a history with air hockey. And so I just brought him down here to see something different than the floor he had been on the whole time. And he clearly loves air hockey, and so I think he thought it was built for him because we came down here and he just had the best time. But that's why we built the place. It really provides a positive outlet for the kids that come in and may go through a tough operation, recovery, that type of thing, and gets them through it.
You know, you make connections with all patients. Sometimes if you have a patient and you see them once and you have a surgery and you don't see them again, and then there's other patients that you have a surgery and then you see them continuously. And Josiah is one that we will see for a long period of time, and we'll follow him into adulthood. And I think for those that you see over and over every couple of months, you get to know them and you get to know the family. We look forward to knowing what's going on in their lives and what's going on at school and being part of watching them grow up.